Hey everyone, welcome to the Commercial Carrier Corner series. I'm your host, Jared Taylor. Joining me today, we have the Director of Financial Planning and Analysis at Werfen, Jason Hamelin. Jason, how's it going?
Hey, I'm doing great. How are you, Jared?
I'm great. I'm excited to have you here. Let's dive right in. We usually get right down to it. First question I have for you is senior finance executives, they have a tough job, but most of them don't realize that healthcare costs are typically a company's second or third largest line item. So my question to you is how do most finance leaders manage healthcare costs today?
Sure. Yeah, great. Thanks for the question. So I think first and foremost is really having a good relationship with your broker. I think that's kind of top of the list. And, if you have that, then you can get a lot of help understanding your healthcare costs. And we like to really dive in deep on a quarterly basis, keeping abreast of, any high claims, which could potentially have, an extended impact on your financials. So just kind of really having a regular cadence around transparency and communication. And, in addition to that, I'd say asking your broker to continue to keep you up to date on, latest trends in health insurance and to bring innovative solutions during that annual open enrollment decision-making process. And then also, educating employees on the cost of healthcare with the help of your broker by giving them tangible examples of where they can save money for themselves by spending less towards their deductible while at the same time, saving money for the plan. So that's kind of a good ongoing way to, help keep some cost control. And, some examples could be through utilizing external providers for things like MRIs, X-rays, lab tests. So I think really it's about finding ways to have transparency, like on your own through the financials, through communication and discussions and meetings with your broker and provider, and through education, across the employee base.
Now, Jason, 2025 in particular is estimated to have the highest employer healthcare costs of all time. So with rates rising another 8% on average, what when a business receives a significant healthcare cost hike, how does that impact things like wages, benefits, and other investments?
Yeah, absolutely. So, with the cost of healthcare, health plans being such a, number two, three expense for the company, can have significant increases in those costs can really hurt the business and really put challenges and strains on the business in a number of ways. And I think, it can potentially change the plan design for employees. By having increased premiums and deductibles and out-of-pocket maximums, so it can kind of have a negative consequence on the staff, and we can talk more about that, as well as lead to employers sometimes having to offer less benefits in order to try to mitigate those increases. And those are all things that you start to think about through plan design when you hear, oh well, I'm going to get a 20% increase in my health costs this year. Well, what am I going to do for cost mitigation? But at the same time, try not to burden the employees too much. So this really, it can really lead to a decrease in employee morale, and it can also lead to a significant increase in attrition of your workforce. And those companies that where they consider their employees their biggest asset, it can be a competitive disadvantage if you can't find ways. If you can't find a better way, a better plan, a better way to design it. So that's one thought. Secondly, it can also cause companies to have to look at other areas in their budget for cost savings to help offset those increases. So for companies like ours, where we invest heavily in research and development, and we rely on this to come out with the latest innovation in medical device products. And what that means is this can have a negative impact on the future growth of the business, as well as kind of a global health impact where it can slow the speed of healthcare innovation in the world. So when you really think about it, it can it doesn't just impact your own company, but it could also impact those that rely on your company.
Now, what is the role of the broker throughout this process, and what have the best brokers you've worked with done to support you in this?
So yeah, I view the role of the broker as twofold. So one being an educator, and secondly being an extension of our human resources department and an advocate for patient care and at the same time cost control. So that they play a really big role in helping to guide us during this process. And I want my broker to always be looking out for the best interest of the company, but also the employees, in helping to find, help us to provide the best care possible for them. So the best brokers I've worked with have done exactly this, and they make themselves available, whenever, if weekly, monthly, quarterly, however frequently you need them. You can always pick up the phone and call them, send them an email. We tend to meet quarterly to review our spending and progress to what we budgeted, and discuss kind of what's driving our healthcare spend. They meet with our employees to provide continued education on how to cost effectively use the plan. They help employees navigate the complexities of the healthcare system. If you've got somebody that is kind of really in a healthcare situation that needs some high touch, a great broker is going to be the person that's going to offer that kind of white glove experience for the employee. And I think the best ones just kind of genuinely care about others and care about the employees and want to do what's right and like to help people.
Last question for you, Jason, before we wrap up here is, saving money is great, especially for the finance team, but benefits are incredibly important to employee compensation, experience, retention. How do you balance the cost and experience for employees?
Balancing the cost and experience. So, I mean, in order to do that, you need to look at all of the different, cost containment solutions that are out there. That's kind of really the only way we've found to be able to find that balance. And it's a lot to take in, if you're kind of new to this type of stuff. But with a great broker that can really educate you. So, some of the things that we've looked at and started to have implemented over time is, one being, a health savings account. And I think I'll probably kind of go through a number of the things that we did. So having a health savings account, and that's going to help employees, reduce their personal tax basis while providing a kind of a regular savings mechanism to pay for medical expenses. And it also enables them to grow funds, through investing. And employees that take a longer term view can see this as a huge benefit, because it allows them to grow funds tax free. It enables them, to use funds later in life for, future potential medical expenses. Secondly, I'd say looking at high deductible health plans. We made this an option for employees to choose. These tend to come at a lower cost for employees, and we see a lot of our younger and healthier populations taking great advantage of this. Another thing I can think about is telemedicine, and this has really taken off, especially really over the last 4 years or so, where it's just a real big help to employees who can call in for kind of a minor illness, something that can be treated over the phone, get treatment plans and prescriptions over the phone at no cost to the employee. So that's saving the employee having to pay copays, having to pay towards deductibles. And kind of following on with that is a prescription drug cost management program. So things like the Me Too drugs, where there's kind of immaterial tweaking of ingredients in a new drug just so they can extend the patent protection. And, that type of program can help suggest different drugs, prescription drugs that are offered sometimes when an over-the-counter alternative could be available. So this type of program can kind of just help navigating, okay, like what's the most cost-effective way to treat what I need treated. And lastly, brand name or higher price generic drugs being offered when maybe there's a lesser price generic. So a prescription drug plan can go a long way. We took the step towards becoming self-insured because of the size of our company, and we were big enough to be able to afford to do that. But really, I think the biggest and most successful strategy we were able to play was going to a reference-based pricing strategy. And so that was something that enabled us to save 30% as a company versus being on a traditional plan. And now, having had over 10 years of experience with this type of plan, I can confidently report that the savings have been there steadily on a long-term basis. It not only saves money for the company, it also saves money for the employees because they're paying less. It takes them longer to meet their deductible. So that's kind of been a win-win, for both. So when you think about that balance, so I think companies that are really feeling the cost pinch, this is certainly a strategy that I'd suggest that folks seriously consider if you haven't already started thinking about it.
Well, Jason, I want to thank you so much for sharing your thoughts on a couple of these questions here with us today, and look forward to future conversations. But I know our audience will appreciate your expertise on these topics.
All right, likewise. Thanks for having me.